Assalamualaikum and good morning to everyone. Today I would like to interview about the people to have a trauma in their life. Before I start interview, I want to tell you about trauma. Trauma means someone who made an emotional reaction that had an extremely negative event in their life. And now I will ask someone who has the trauma in their life. That is Mr. Ishak. So, Mr. Ishak, can you tell me how did you got trauma?
Okay, firstly, I would like to say thank you to Mr. Shauki who invited me in this interview. Based on my experience, I got my trauma since I was in my childhood memory. Since I was in childhood, when I was on a primary school, lots of my classmates always bully me, always beat me, ask me for the money and everything. So in that extremely bad accident, that made me had a trauma. I mean, like, after that incident, I felt afraid to communicate with other people. I felt afraid to overcome my confidence, to take a risk in my life. So I think that's the problem. I think that's the root of my trauma begin.
Oh, and second question, how do you feel a trauma?
Okay, the most important effect that I had when I had a trauma is that I had an anxiety. The anxiety that I would like to say is that I had anxiety to interact with other people, to communicate with other people, to take a risk in my life, and I mean everything. I had an anxiety on everything. Even sometimes, if I'm going to the crowded places like a mall or any event, I will feel scared. I will feel like, oh, someone gonna beat me up or everything. So that's the most important effect. That's the most biggest effect that I had when I had an anxiety. And another effect that I got when I had a trauma is that I always have a racing heartbeat. I mean, sometimes when I sit alone doing nothing, my heartbeat will chase so fast, like I'm running. So I think that's gonna affect my life.
Okay, thank you, Mr. Ishak. And now I will introduce you the psychology who treat Mr. Ishak, Dr. Lostisman. So, Dr. Lostisman, how do you treat your patient to overcome a trauma?
Okay, in my job industry, nowadays I'm so many trauma patients in my hospital now. So I'm using many steps by using consultation and giving some motivation talk and many more. So there are several activities also we are doing, like having group discussion with all my patients to talk about their feelings, in their mind, and then who are mildly disturbed.
And second question, what is your ambition for someone who had a trauma?
My ambition is, nowadays the trauma day by day is increasing. So my ambition is want to less the trauma patients, like having more like NGO programs, like helping others for people who around the area, like around pedestrian or like playground, like having a campaign, like having gotong royong together, and having like charity campaign. So I hope in future there will be no one affected by trauma, and then we can build a community free from trauma. Yeah, that's it from me.
Thank you, Dr. Lostisman, for sharing about trauma.
You're welcome.
Thank you. At the end of my interview, I am hoping that community nowadays will understand and care about trauma. Thank you and have a nice day.